Hi everyone, I'm Daniel Williams, Senior Editor at MGMA, and we are still at the 2025 MGMA Leaders Conference, and I am here joined by Linda Carroll. Let me see if I can get this right. Linda is from the Aurora maternal-fetal medicine practice in Alaska.
Perfect.
Linda, thank you so much for joining us.
Absolutely. Thanks for having me. I appreciate it.
Yeah, no, we were talking, you traveled all the way from Alaska to Orlando, but what we found out was you didn't travel the furthest distance.
We did not this time. So there is an attendee here from Qatar, Marianne, and she's amazing. I met her last year at conference, and we stayed in touch. And so, it was great. She reached out prior to conference and asked if I was coming because she said she was going to be here. So
yeah, that is so cool. So let's just talk about that, because thank you for your dedication to travel all the way from Alaska. What was that travel like? Where did you traveled from? Where to get here to Orlando?
So fortunately, it was a nonstop flight from Seattle. So we go from Anchorage to Seattle, short layover, and then we can get a nonstop from Seattle to Orlando, which was really nice. So it was still about a 6.5, 7 hour flight nonstop from Seattle to Orlando.
Are you a good traveler?
I am a good traveler.
Okay. What do you do to occupy your time when you're on a plane that's 6 or 7 hours, a flight that long?
Well, usually I take a Dramamine.
Okay.
So I usually sleep, but depending on the time of day, like this was an overnight flight, so I definitely was able to get some sleep on a plane, and I can sleep fairly easy on a plane. But usually I'll watch some sort of in-flight entertainment, or if it's a daytime flight, I'll have a book with me that I read.
Okay.
So,
We've talked about books before. So Linda, you've joined us on the podcast before. We were talking about, what's the book? H-Mart? What's the title of it?
Crying in H-Mart.
Crying in H-Mart. So what have you been reading lately that's good?
So there is this book, and it's not what you think based on the title, but it's called Sex Before Dawn.
Okay.
But basically, it's just like talking about just like the history of like couples, or like why people want to be coupled up, or just like that kind of natural progression. Or there's this like tendency to the natural evolution is you don't necessarily want to be coupled up, just because like at the dawn of man, it was about just like creating population. And so it just kind of is supposed to go into all of that. I've had this book for months and I cannot get past like the 3rd chapter. So I'm just like, I don't know. I guess maybe I'm not finding it interesting, but I start it and then I'm like, okay. And then I'm, read for a little bit, and then I go to do something else and I'll read another book. And then I'm like, oh, I should try to go back to that book. But I just haven't been able to get back to it.
Well, the way you set it up, it was so fascinating, but then sometimes the description of a book is better than the book itself.
Yeah.
So, wow. Okay. So you've got a lot going on here at the Leaders Conference. You led a resource group on AAPI. Is that correct? Tell us a little bit about that resource group. Have y'all already met, or are you going to be meeting later?
We did meet. We met on Sunday.
Okay.
And so I actually co-hosted last year at the 2024 conference, and I think it was the first year you guys had those resource breakout groups. And so, so it was really great. We've had quarterly calls throughout the year. My co-facilitator, Deepa, she's amazing, and it's really nice just because the two of us, we have different perspectives. Obviously, what do you think about this? What do you think about this? Or like questions neither one of us maybe would have thought about, to kind of help facilitate the conversations that are happening there. For us, it's a small group, but it offers, to me, I feel like it offers for a little bit more personal conversation, and we can really kind of dive into certain topics.
Yeah. Did anything emerge from this year's discussion that y'all had that really stuck with you?
I think a lot of it is just like in our roles as leaders, typically in our company, I think like with the physicians we work with, it's kind of funny because we talk about, having some cultural sensitivity, and maybe they're aware of it more with staff. But I like gave an example of like one of the physicians I used to work with who was like, oh, we should have a particular holiday off because we have an individual who's like, that's important to their culture. And I was like looking at that physician like, do I get a holiday then?
Right.
And he just kind of looked at me kind of like dumbfounded, like, what do you mean? And I was like, and so I feel like sometimes just because you're on a different level, you're on a higher level, as far as like staffing goes, that sometimes maybe they're oblivious to some of those things, which I mean, in one sense is good that they're not like just seeing someone's outside physical exterior, but at the same time, it's like, oh, please don't tell me you're like that naive to something like that. And so we talked a little bit about that. And like some of the conversations, of course, just, one of the things that we talked about right now, like what are we going to do if certain entities show up at our practice?
Okay.
And, like the physician I work with, for her, she's Caucasian. She doesn't even think about like those kinds of things never cross her mind about, I'm afraid to go to an appointment. I'm afraid to go to the grocery store just because I don't know what's going to happen to me right now.
Right.
So in having this conversation of telling her, well, we have to have a game plan for our patients when they come to the office, or if they no-show, we always call our patients to say, can we get you rescheduled? This appointment was your appointment with the doctor is very important. Right. And we also want to find out like some factors, like if they don't have a ride, I'm like, well, we can help you with the ride. We can get a ride for you, within the community. There's entities that offer rides to doctor's appointments. So we always just at least make one call to find out if there was some barrier to that. So for her, she was like, oh, because that's not something that really affects her. She doesn't have to think about it. She was like, oh, well, she's like, I don't know, whatever you think we need to do. And I was like, that's great, but we also have to be on the same page when I present this. Right. And so that was just another example sometimes if we're just like, depending on the individuals we are working with at the leadership levels, just some things that it's not that they don't care, they're just not aware because it doesn't necessarily affect them per se.
Right. So. Well, being in a maternal and fetal practice as you are there any of the appointments that can be done through telehealth, or do they physically need to be in that office so you can work with them in that way?
90% of our patients have to be in the office because they're having an ultrasound at that same time. There are some patients, our diabetics, if they're just having a weekly diabetic check, we can certainly do that via telehealth, and we've been doing that. We also provide preconceptual counseling, and so those appointments too, if they're coming from outside of our city, we will set those up as telehealth as well, so they don't have to like travel from Fairbanks, which is like a 6-hour drive.
Oh my gosh. Okay. So you're serving patients that are in a 6-hour travel region?
We actually, there's only 4 MFMs in the whole state of Alaska. They're all in Anchorage just because of the hospitals being based there. We provide services to patients all across the state. So we'll have people that come in all the way from Nome and Uptiavik, Fairbanks. So they're traveling like sometimes because they have to take multiple flights just to get to Anchorage. If they're coming from a smaller village, it will take them more than half a day just to get to Anchorage. And normally you can take a flight for half a day and be in like 5 states over. So it's very, it's very different in Alaska as far as providing care. And I know that there's a couple of other states like Montana, Wyoming that are very rural in population, that's where everything is spread out. And like the next closest city, is hours away.
Yeah. Well, thank you for the work y'all are doing there.
Yeah, thank you. So, and our physician, she's born and raised from Alaska. So for her, it was really important in her specialty to come back and provide care for the community. Okay. So,
So let's switch gears. We've been in Alaska in our conversation. Let's bring it to Orlando. You've been here for several days now. What's something that stood out to you? What's something that you'll take away from it, either from a educational session or from networking or anything else you've been doing?
Well, definitely for me, conference, the networking. I mean, education's great, but the number one thing is networking, meeting other individuals in my same specialty or very similar, like women's health, and just to hear not only what's happening in other areas, but like what are some issues that are specific to us that we're dealing with and how are we handling that? So it's always great to have that network of peers. And then I definitely think for me, the weather. Being here, and it's not so much like the heat, it's the humidity. Those of us from Alaska, we are not used to the humidity that's here, so.
Well, it is jarring, and I was having a conversation with some people last night. We were actually watching Monday Night Football in the bar here in the Hyatt. And they heard the accent and they said, "Where are you from?" And I said, "Mississippi and Alabama." But I've been out west, either in California or Colorado the last 25 years. And I told them, moving away, I do not handle the humidity. It's not built into my DNA, you know, now that I've been away for 25 years. I don't handle it well either. And it's almost chilly in the convention center. You know, they got the air conditioner blasting, and then you go outside and you just immediately melt a little bit. But one other thing before we sign off, I wanted to ask you, we were both at a party last night, the Jackson Physician Search Party.
Yes.
We didn't even see each other because there was so much going on there.
Yeah.
But how was that experience? What was it like to get out and kind of kick your heels up, so to speak?
It was great. The one thing that's nice about like coming to a conference like MGMA, you're with your peers.
Yeah.
And like for those of us, you know, in our leadership roles, we've talked about this many times. For all of the years that I've been coming, it's, you know, being a leader, it's a lonely job because you're not really socializing with the physicians, and you're certainly not socializing with your staff. So coming to something like this, it's like a safe place where you're with your peers, your colleagues. You can, like you said, kick up your heels a little bit, relax, and just kind of be more of yourself in a social environment, and just feel good about it and have a great time. You know, have more casual social time with individuals that you've met throughout the day. Like throughout the day, you were just like, oh, great, yes, let's meet up later. And we're kind of going here and there to our different classes. So it's nice to be just in a totally casual social environment and really get to know the individuals.
Now, rumors have it that you made it out on the dance floor last night. Is this true?
We did. We definitely took advantage of that for sure.
Well, that is so cool. So sorry I didn't bump into you there, but glad to connect with you here.
Absolutely. Thank you so much. It was great to see you here as well. So.
Yeah. All right. Well, Linda, Carroll, thank you so much for joining us here in Orlando. Safe travels to you back to Alaska.
Absolutely. Thank you. So good to see you.
You too. All right. This is Daniel Williams along with Linda Carroll. We are at the 2025 Leaders Conference in Orlando. Thank you so much for being MGMA Podcast listeners.